Yeah, I'm Seemit Dhage. I'm the head of healthcare industry for ServiceNow. Yeah, I'm a medical doctor by background. I used to work in the NHS as a doctor, and then I've been working in the healthcare technology space for close to 16 years. I work for ServiceNow, which is a platform and software as a service company. So we specialize in what we call as digital workflows, which is, managing that information exchange that takes place between patients and hospitals, or patients and clinicians, and even within hospitals, say, between those employees and technologies, or technologies to technologies. So we are an experience-based platform. So our kind of mantra is, how do we give time back to employees working in hospital? And as a clinician, I can say time is the currency in healthcare. And what we focus on is giving time back, and therefore, improve the experience and for employees working within hospitals. So that's about me and ServiceNow.
Yeah. So 16 years in digital health space. What have you seen change in your time?
Oh, big time. I mean, I used to be an orthopedic surgeon.
Wow.
And when I was still working as a clinician, I would hold X-ray films and MRI films up against the white monitor and look for, fractures and things like that. And now we have, so I saw the journey from that becoming digital. So from analog films becoming digital. Then, we had the AI coming in and clinical decision support, etc. So, that is, I would say, an example of the clinical, kind of workflows being digitized. But what has happened since COVID is even the non-clinical kind of side of things has become digitized, right? So previously we thought of as, say for hospitals or health services, very focused around four walls of that service, right? So you had to go and meet the clinician to do something. But now, even the clinicians and the administrative staff, they work from home and try and do a lot of their activities sitting at home. So there has been a gradual, I would say, a transition on of how service has been delivered, especially post-COVID, where we now look at, new ways of service delivery and digital technology that have actually enabled that. So a major transformation accelerated by COVID in the last, I would say, 4 years.
And I guess from a ServiceNow perspective, what do you think makes a good platform? There's a lot of platforms out there that clinicians can choose, or hospitals can choose from. What do you think is kind of the differentiating factor between platforms that clinicians want to use versus maybe what clinicians are forced to use?
I've been speaking to a number of CIOs. One of the CIOs mentioned to me that, every week he gets a request from a clinician. It could be a clinician, focusing on renal dialysis, or it could be an anesthetist, or it could be a surgeon saying, I need this new digital gizmo for my patients. Traditionally, they have been doing that. You look into a particular hospital, they have anywhere between 50 to 150 different systems. Now, what that leads to is a large technology debt, islands of technology which don't talk to each other, and there's no absolute control over, what is happening. It poses risk around patient information exchange, etc. Working with an enterprise platform such as ServiceNow, it starts off, I would say, not only supporting those kind of clinical use cases, but it is traditionally embedded within, for IT. So, departments, IT departments and IT providing service to its internal customers, that has been the starting point for ServiceNow. And this is where the familiarity comes in for the CIO. Going back to that CIO example, is they say, I've already got ServiceNow. Let's build it on ServiceNow so that we have everything native to ServiceNow. So that single enterprise platform with the single data model, single architecture, and all those relevant workflows running off ServiceNow is where, it differentiates ServiceNow from some of the other point solutions or other, I would say, platforms out there in the market.
And do you think that also includes a level of interoperability between your other systems?
Yes,
for that as well.
Absolutely. And again, ServiceNow, barring maybe a couple of, I would say, use cases, we are not a system of record, and we rely on those interoperability information exchange. We have out-of-the-box APIs, which, you're exchanging PDF, or we have a hospital here in Gold Coast who have built their own application where the medical photography is, put onto electronic medical record. So those sort of integrations, if they're not out of the box, we build them. But, with those, we also bring in things like automation, where robots can actually pull and push that information without, an employee trying to manually undertake those or triggering those workflows.
Amazing. And I guess we're here at a Melbourne, Australia Digital Health Festival, and you've got a lot of international experience. I guess I'd like a bit of your opinion on where Australia is at. You're talking to a lot of people out across the digital health space. Where do you think we're at in our journey in digital health?
Oh, I wish I can, had my own... I had my own scale of ratings and systems. Yeah. But I would say, there are common themes which come out of publicly funded health systems, right? And I would say the number one thing is they're usually cash strapped. So there's not a lot of, I would say, money flowing in, even though there is intention to invest more. Sometimes there are question marks whether investing more is the solution, because we can, look at improving productivity, etc. So I would say first is the availability of funding. Is one of the theme that the second is availability of skilled workforce. And again, traditionally when we say skilled workforce, we look at nursing and doctor shortages. Now, for example, in Australia, I was reading some of the statistics. They're saying there's going to be a shortfall of close to 100,000 nurses and 2,000 doctors in the next few years because of, a high attrition rate because of, frustration related to working in the health context, or not having enough, I would say, distribution, especially for the rural areas, or you just have an aging workforce, especially in the primary care sector with GPs retiring, etc. So that's the kind of the second theme. And I would say, going back to your question, it's quite common. The third thing is, I was mentioning earlier, these are, lots of investment into point technologies where there's a large technology debt, where hospitals and, health systems are not able to keep up with this. And even those systems are failing at times, saying, 3 years, 4 years down the line, where is the, how is it now suitable to what we were planning to do with it? So I would say these are some of the common themes. If I go back to your question about where Australia is, I think I see a lot of government initiative in terms of, focusing on those, a lot of consolidation and thinking around, how do we bring those common strategies out. And again, one good thing about public health systems is, if it works in one particular area, it's easy to be, rolled out into other hospitals, etc. So I think we will see a lot of, let's test it and deliver it out across the entire health system. So I think that in that way, Australia is kind of well positioned to do this.
Do you think any other countries are overcoming any of those challenges well? Do you look to other countries and go, we could learn a few lessons here?
I would say definitely, yeah. I work a lot with Nordics. Again, they have similar challenges, especially on the nursing shortages, staffing. So they have taken, I would say, care pathway programs, digitization programs. They are, I would say, at least in my experience in on those public health systems, they seem to be ahead of the curve in terms of their thinking. Especially with, how they're managing patient data, bringing some of the interoperability elements in it. So I would say, there are things that could be learned from other health systems. But again, there are, pockets of brilliance happening across the world. It's maybe it fits, maybe it doesn't fit, to the Australian purpose.
Yeah. I think so here at Digital Health Festival, have you had any chance to speak on any panels yet? What do you get to speak about?
So I've had, a couple of panel discussions. I had one around workforce redesign in hospitals and service redesign on the hospitals and the role digitization is going to play. And one of the elements I mentioned was, again, going back to our earlier point about, having that enterprise platform approach, moving away from point solutions to rationalizing the spend and trying to standardize those things. Tomorrow we have an interesting talk with Gold Coast Hospital, which is one of ServiceNow users. They have, built a number of applications themselves using their clinical teams. They've done outstanding work, especially in terms of, saving hours of employee time and therefore raising that productivity.
Yeah. Do you think that's because the clinicians are kept at the very beginning of the design process, because they're working in the hospital, they're working, I guess, with IT teams building these applications, why they've been so successful?
Yes, I mean, clinical input and I would say clinician supported patient-centric designs, is again one way of, that design thinking in terms of developing these solutions. But I would say having that platform strategy, prioritizing your projects, looking at, how do we strategically manage those projects? Because again, like any other hospital, you have finite resources, finite time, budget, etc. to manage these things. So where, again, some hospitals are successful is to be able to, bring those elements and get their strategy execution right.
Yeah. I'm sure it wasn't a small feat to redesign an enterprise platform.
Absolutely.
It's not something you can just plug in and play. Amazing. Sounds incredible. I'll be sure to check out tomorrow. Anything else you'd like to add about Digital Health Festival in Melbourne, what you've seen, anything that's interested you?
Yes, I mean, again, there are quite interesting themes, and I've seen a few conversations around Gen AI, which is again the next, I would say, wave on the technology horizon. There are more and more use cases we are looking at in terms of Gen AI, especially on the patient-facing side of things. How do you support patients through generative AI? In kind of even say raising a complaint or compliment, or summarizing their clinical summary of their situation, etc. So I think those are some of the interesting things which are coming out.
Yeah.
And I'm sure there'll be many more in the coming years to come.